And then we'll go ahead and do some introductions amongst the ECHO team. So Renee, if you could go first and introduce yourself.
Yes, Renee Bolio-Banks, Indigenous. I'm Renee Bolio-Banks. I've been at NACC for about 4 years and I absolutely love it. I'm the elder in residence and that's about it. I'm a grandma.
Okay, and then Lindsay.
I'm Lindsay King-Cooney. I'm the Community and Tribal Engagement Specialist here at NACC.
And Dr. Robbie.
I'm Kari Robbie. I'm a family practice and addiction medicine physician. I've been at NACC for 12 years.
And Michelle.
Hi, I'm Michelle Corcoran. I'm the MAT nurse manager at NACC. Welcome.
And my name is Tina. I'm the harm reduction program supervisor here at NACC. So Lindsay is going to share just a few preliminary slides before we hand it over to the speaker. So today, we're going to be talking about centering culture in the treatment of opioid use disorder with American Indian Alaska Native communities. So for those who don't already know, Native American Community Clinic is located on Franklin Avenue along the Native American or the American Indian Cultural Corridor. We offer primary care, medication for opioid use disorder, including Suboxone, among a couple others, infectious disease, intervention and treatment, social service supports, dental, behavioral health, intensive outpatient treatment, spiritual care and traditional healing services, health promotion and maintenance programs, and then harm reduction services.
And then a few session guidelines. Please know protected health information. We ask that you mute yourself if you're not speaking. Feel free to eat your lunch during the session. And then if you could let us know who you are in the chat function, that would be great. Then I know who to send the survey out to after the session. And then we invite you to also use the chat to ask any questions or comments. Some announcements. So our next session will be in 2 weeks on February 15th, and that's with Mindy Bird from Sanford Health, and she's going to be talking about their Mending Broken Hearts program. And then on March 1st, Dr. Christy Patton and her team from Mayo Clinic, they'll be discussing their Facebook program they're researching and designing for American Indian women in opioid use disorder recovery. This is a list of a few other ECHOs that cover similar topics, Hennepin Healthcare, Indian Country ECHO, and Stratus Health, who we partner with. And then continuing education, we do offer CE credits for this session. We just ask that you fill out the survey that I'll email out to you, and I'll also put it in the chat to get the credit. And then case presentations, we always welcome and encourage them. If you have a difficult case or a story to share, makes for a great discussion. So I think that's all for me, and I'm going to stop sharing and hand it over to our speaker. Welcome, Melanie Nadeau.
Thank you, Miigwech, for that beautiful, beautiful prayer and starting in such a good way. I really, really appreciate that. We need to do it more often, and I really love it when I'm in spaces that take that time. And a lot of the issues that we face today is because we don't take the time, right? Or we don't have the time. We're all just, things kind of get chaotic at times. But yeah, so my name is Melanie Nadeau, and I'm from the Turtle Mountain Band of Chippewa Indians. I Joani Gijigoikwe Indigenous Cause, Mikanak Waju and Dujabar, and Makwa and Dudam. Seeing the pictures of NACC and the cities, that's where I did my master's and my doctorate, and I was a first generation college student, and I ended up going up there, and it was pretty scary to make the move from the res up to the cities, but the community there was just so welcoming, and I just fell in love with the urban community. That my time there, I was highly engaged, and I'm very active on the Minnesota Indian listserv, and have a lot of really good memories there. And really appreciated my training and time with the Native community there. And thank you for the Miigwech for the land acknowledgement. It's so very important that we acknowledge the land that we're on. So thank you. So now, and then I'll just say that I'm going to have to jump off at 1 o'clock. So I'm going to try to go through this in a good way. Really the point of this, and I might be a little bit more casual because, you know, I want to share my story around how I ended up getting involved in this national collaborative board. And Paulette Buckle, she's the one who had pulled me in and said, you know, hey, Mel, do you want to be on this national collaborative board? I said, sure, you know, and so we ended up going down to Albuquerque and this collaborative board with natives from all walks of life, and I'll go over the details, came together, and it was just so very powerful. And the researchers that brought us there, they had a very in-depth overview of what was in the literature, what was happening in the Indian country, the crisis, kind of the big picture, kind of grounded us in the methods and things that looked promising practices, the existing evidence base, which was bleak, data considerations, and this idea around centering our processes, you know, having processes that are grounded in culture and using culture at the center of this. And so when we were down in Albuquerque, we ended up doing this Res Cafe as a group. And it was very powerful. And that's what I'm going to be sharing with you today. So get this started. And this is a publication, so I'm basically going over the findings of publication, so you could read this if you'd like. So, let's see. No disclosures. And so here's the group of folks that came together in Albuquerque. We were from all over the place, all walks of life, different professions, disciplines. Some were there that were in recovery, some were treatment specialists, researchers, and community members, and elders, and traditional individuals. And so it was really the core of this whole initiative was, you know, the implementation science to increase health equity. And so using implementation science to promote health equity. And so they, like I said, they really grounded us in everything that was going on. And they really wanted to combine community engagement with implementation science to develop an intervention to increase the successful integration of MOUD into clinical sites serving Native communities. And then here's the huge network, which I'm sure you guys are all familiar with, all the nodes in this initiative. So the rationale for the culturally centering MOUD with American Indian Alaska Native communities, this particular initiative that put together this collaborative board was education, training, and implementation of the MOUD. And, you know, this idea that it must be tailored to the individual communities and integrate Indigenous health perspectives and knowledges with Western medicine to successfully improve the health and well-being of the people. And the aim of the study was to develop and test this implementation intervention to support healthcare or addiction specialty programs to culturally center the delivery of MOUD with American Indian and Alaska Native consumers. So with the background of the study, it was urban, and, you know, it's still going right now, or it's urban and reservation areas was the initial targeted area, and they're working through that now. The collaborative board, we were convened to for 3 reasons. We were to identify key components of culturally centered implementation intervention. We were to introduce and tailor implementation science strategies. And we were to build partnership with our academic research team for bidirectional learning in achieving the study aims. They've kept us engaged. This was in 2019 when we met, and have kept us highly engaged in the process of not only launching this research, but also in the guiding the development and cultural adaptation of the tools that will be used and administered as well. So the lead investigators, they brought together 26 of us, and there were physicians, behavioral health providers, Native people, healing and worldviews, Native adults with lived experience, elders, an ethnobotanist, CTN representatives, dissemination and implementation experts, and Native researchers. And it was October 2019 in Albuquerque. And so, just kind of the precedents and a focus at that time was just they did a lot of preliminary work. We spent like the whole day just going over like literature and, grounding us in what was happening, not only from the current data, what we were seeing, but what the literature was saying. And these are just some of the key things that came from this needs assessment of tribal MOUD, this particular study from 2020. Some of the challenges and risks were the treatment access, transportation, insurance coverage, unstable housing, privacy, wait lists, historical intergenerational trauma, boarding schools, loss of language and land, cultural disconnection, economic stress, mental health comorbidities, and polysubstance use. The protective factors were cultural cohesion activities, family units dynamics, provider-consumer communication for non-Native provider education and exposure, integrated care and case management. And the researchers wanted us as a collaborative board to, they really wanted to know what we thought. And so once we went into our Res Cafe, so we ended up doing an adaptation of the World Cafe, and we did a Res Cafe. And so once we went into the Res Cafe, they really wanted to tap into all levels and get our opinion on what we thought was going on. And so we adapted this Res Cafe method, and it was qualitative, or I should say they did it, qualitative facilitation method. It's culturally congruent, collaborative process that allows for meaning making together with an invitation for participation through discussion, writing, and illustrations. Roundtables were set up with flip charts, markers, voice recorders. Members were split up into groups, about 4 to 5 people each, and given 15 minutes each to discuss each core question. The mind maps, the question or theme was presented in the center of the flip chart with the ideas generated from the discussion and branching out. There were 3 coders that independently reviewed and reviewed the transcripts to identify themes. Collaborative board members were solicited for interpreting the results. And so how do I fit into all this? Well, I'm a trained social behavioral epidemiologist, and I've worked about 20 years. Well, I've lived and worked in tribal communities all my life, but the last 20 years I've worked with tribal communities on research evaluation initiatives. And I was actually at the table as an American Indian researcher. And then so they tapped into that. And when we had this activity, I just said, well, I would like to publish this, and they were supportive of that. I just thought it was really important to get this information from the collaborative board out to the general public on what we felt as a collective was going on with this particular thing. And so I was I helped to write the paper, and I analyzed the mind maps and interpreted the findings from that. And so the objectives were to describe complex causes of OUD among American Indian Alaska Native communities, to discuss cultural strengths, integration of healing traditional practices and holistic approaches to wellness in MOUD, examine the process of using mind maps to identify the similarities and the differences across treatment perspectives, centering wellness versus that, and then to discuss the importance of providing culturally responsive service to Native communities. So some of the causes of OUD among American Indian and Alaska Native communities, I'll just say Native communities, and these are the reflections and the collective thoughts of the collaborative board. So just keep that thought in mind. That's where this information is coming from. So, they said individual stress, depression, loneliness, low self-esteem, One collaborative board member said stress, anxiety, probably mental disorders, having a mental health comorbidity could be a trigger. History of adverse childhood experiences, historical and intergenerational trauma, family cohesion and traditional family practices were eroded by colonization, forced relocation, other systematic forms of oppression, trauma in general, lack of social support. So the stereotyping, emphasis on medical professionals targeting and labeling Natives as addicts. And there was a lot of focus on the destigmatization and the words that we use, and that we like this idea around that our words should be healing words, you know, not stigmatizing words. And like instead of saying, oh, you know, you're an addict, or it'd be like, well, no, you're a human being, and you're someone that's healing, you know, you're on your healing path. And so really taking that perspective and allowing that space for people to heal, and that healing is achievable. And that, you know, staying in that space and that stigmatizing space can actually cause more harm and lead to more use. The importance of having a compassionate workforce that does not shame or stigmatize and maintains confidentiality and trust. Initial contact, crucial to bridging the gap between the individual and provider. And so just these recommendations around allowing walk-ins, being flexible, personalizing the treatment goals, understanding of both the short and long-term goals, building rapport and collaboration, and then learning from the programs that are models of care, because there are some really successful initiatives that are out there, and taking the time to see what's working and see if that can be translated to other spaces that are doing this good work. So, you know, there's examples of successful tribal treatment programs, medical home programs, and there were recommendations around having a customized menu of options and providing medications on site. Drugs have been normalized as a coping behavior in some Native families. Healthcare system, providers not delivering adequate information, providers not managing clients well. And a lot of this was around, you know, just the time. Providers are not allowed sufficient time to deal with some of these issues. There are physical injuries leading to longer-term substance use disorders. So someone may go in for an injury, and then all of a sudden they're addicted they're addicted. Prescribing opioids with a one-size-fits-all approach, and this idea around, like, you know, what's given to one person might be not as effective or too much medicine for another person. And, you know, how can we tailor that? So causes of opioid use among Native communities. So here's a quote from one of the collaborative board members. I think a lot of people get into it. They'll have an accident of some kind. They'll get a pain prescription, oftentimes a little bit excessive, or it extends too long. And then I think sometimes the provider realizes the pain should be minimum right now, and they either will just abruptly discontinue or not taper. Then people go through withdrawal, and a lot of times people will then either buy pills to try to manage their pain or the withdrawals. They'll turn to heroin. I think people are often set up for opioid use disorders. Opioids viewed as an acceptable drug that's not harmful because it's prescribed by a medical professional. And here's another quote from a collaborative board member. Misunderstandings of dependence that can develop from opioids. Some people feel like it's a prescription that's safe, that if it is from a bottle, it's not going to become dependent, or you're not going to be as harmed as as opposed to buying it on the street or from heroin. They'll take a bunch of pills not knowing that could actually lead to overdose as well. So I think it goes back to that misunderstanding about the safety of the medication. And so the first mind map that we did was really focused on our strengths. And it's kind of fun to look at this, you know, the way that this all populated, but, you know, you can see that there's just all kinds of things, like all kinds of strengths that as a collective that we recognize. You know, family was the core. Family was a theme, I would say, foundational theme, and the importance of family, and the importance of family really being a part of this process. But yeah, I'll just give you a second just to digest that and check it out. So lots of things there, and lots of things to turn to heal. So when talking about the strengths, the collaborative board said family support, clan systems, the emphasize the importance of the roles of our men, our women, our two-spirit, and that each individual plays a role. Each individual in our culture, every single person that is here has something to give, and to help our community improve. And we got away from that somehow, but everybody has a purpose, everybody has a role. And, this idea of really tapping into that and understanding that, that might be a role of leadership, family, community connectedness, spirituality, providing resources to family and relatives, providing diverse knowledge to the next generation. And some people, function in multiple capacities as well. So some of the collaborative board quotes for you: family, like knowing about other family members that went through the same thing, or how they survived a similar ordeal, whether it's addiction to drugs or else alcohol. From an individual strength to the traditional strength, spiritual strengths, family, clan, community, tribe, location, any kind of strengths that we can bring to help them in maybe the program aid people in recovery. Broadly, family, social, kind of community networking, religion, spirituality, language, cultural identity. So integration of healing traditions, practices, and holistic approaches to wellness in MOUD, the collaborative board focused on cultural grounding, and that it was really important to provide space for engagement or re-engagement with culture, and that it wouldn't just be focused on re-engagement, that there's a lot of people that were separated from their culture and they're lost, and that having this cultural grounding process could actually help to bring them back home. Traditional healing practices include things like forgiveness, humility, and this process of nourishment of the native spirit. Spirituality, that's just one cultural connection point, and the importance of understanding drumming, songs, talking circle, and there's a huge emphasis on understanding and the language as well. So another quote here: a spiritual foundation must first be built in order for the context of treatment to be understood and for it to be accepted. Taking the time to sit, for example, having talking circles, taking the time to drink traditional teas like cedar water, taking the time to discuss what is on somebody's mind, taking the time to reduce anxiety and to promote healing. Huge emphasis on sweat lodges as well. When you're sitting in the lodge, I can't go into too much detail what it's about. It's almost like a form of meditation. There are songs, there's prayer, they have long walks. The importance of an individual defining what holistic healing means to them, start there. I love that. I'm a researcher. I work with my tribal community on tool development and data collection tool development, because we, traditionally have not been at the table for those sorts of things. And so it's really important that we develop our own data collection tools and validate our tools so that things are meaningful to us and we can address issues in a way that makes sense for our people. Language is a huge barrier in the translation of these processes, when you're talking from Western approaches to traditional approaches. Language is a huge barrier. The words, the language is different, with the native populations, the language is animate, it's living. Everything has life and being. And so, that there's a focus on that. And unlike the, Western, like English, we'll say. And then the even if you're both speaking English, it's very problematic. And, you know, I've worked with the 10 of the 11 tribes in Minnesota implementing Indigenous evaluation framework approach to programmatic level work. And one of the things that we advocated for was the inclusion of a glossary, because the way that people define things, it varies different. And these definitions are they're oftentimes based on culturally grounded views, worldviews, and values. And so once you sit down and define this, you're probably going to resolve a lot of misunderstandings, because there's this assumption that we're all using words in the same way, and it's just not the case. It's just not the case. Not a good assumption to make. Then there was this emphasis on providing opportunities to practice traditional healing, and the importance of celebrating, taking the time to celebrate and honor people, and again, for success. But they define that success. They define what healing looks like to them. So like when I was working with in the cities, I worked with elders on the Circles of Tobacco Wisdom project. And these elders, you know, they had their t-shirts, and they made a turtle on the front of them and everything, and they'd hand them out. And they decided who they wanted to honor with their t-shirts. And they said, oh, I gave this person a t-shirt because they tried to quit, and they only quit for a couple of days smoking cigarettes, but they tried to quit, and they honored that, you know, and that was important to them. And I think that's really important, that you know, it doesn't have to be this big lofty success, you know, that we can honor these, but just making sure that programming or approach, or even at the family level, that we're taking time to celebrate whatever meaningful milestones are to that individual that's struggling. And then the importance of providing opportunity for healing to the youth and providing that space for the youth. And of course, we know, like in our tribal communities, we always want to have youth because they're our future, and we also want to have our elders at the table to inform our initiatives. Conceptualization of pain. We spoke quite a bit about the conceptualization of pain. But, you know, just some of the thoughts that rose out of the conversation was having this menu of options for holistic healing, so that people could define what holistic healing meant to them, and then actually have whatever, how they define it, have that accessible to them to help them move them down their healing path. Providing this space for traditional healing, a dedicated space for that. This consensus that Western-based medicines, opioids, and I'm not going to do that word right, overemphasize relieving pain, and viewed as unsustainable. Through this form of meditation in these long ceremonies, you're experiencing pain. And so just to step back here for a minute, you know, in our conversations as a collaborative board, we talked about how traditionally pain was part of our culture, like part of our ceremonies, and this idea around the mentality of just dealing with pain. And like my dad, you know, my parents are both passed away, but my dad, he used to tell me, he said, you know, he called me Melly. He'd say, Melly, don't ever take those pills. Even if the doctor gives them to you, don't take those pills, you know. And he was just so against pills. I mean, it's kind of interesting looking back on it now, but he didn't even take Tylenol, you know. But he said, you got pain for a reason. Your pain lets you know your limitation. If you take those pills, you could actually hurt yourself worse, because your pain, your protective, you know, your protective mechanism, you're shutting it down. And then you could actually twist your back worse, or hurt your hip worse, or, you know. So I was kind of raised with that philosophy of hey, you know, that it's there for a reason. And then it's part of our ceremonies as well. And so we're really just talking about this idea of reaching a spiritual, higher spiritual level, you know, through the use of the strength of your mind, you know, in dealing with the pain. And so it was really fascinating just being part of this. And yeah, I guess I'll just leave it at that. So through this form of meditation and these long ceremonies, you are experiencing pain. You're facing that pain. You're facing it with people to support you. You're not going through this alone. I think pain has been recognized as a part of the human experience, and different cultures have different ways of experiencing and expressing that and addressing that. And in the client population that I see, some people feel like pain is something just to be endured with suffering, where others are kind of in this learned helplessness where everything needs a medication for it. So it's a wide, very diverse understanding of tolerance and pain. So when they did the mind map, you know, because this was like focused on centering, see this right here. Do the paper honor here and pull up the title, Centering Culture in the Treatment of Opioid Use Disorder. And so that kind of gives you the background and where we were at. And I said, okay. And they threw up this mind map and they had a circle in the center and they had Matt at the center. And it's like, okay. So, you know, we kind of started populating and it just bothered me. And I'm like, well, hey, if we're supposed to be centering culture, why isn't culture at the center? And everybody kind of like, well, that's a good point. So anyway, I brought up a new sheet and we put culture at the center. And so that's kind of the take home from this whole thing. And, you know, and so when Matt was at center, and they're not mutually exclusive, you know, you'll see similarities between the two, but you'll also see significant differences when you put Matt at the center versus when you put culture or wellness, you know, culture at the center. And so, you know, here we see spirituality and then branched off that healing community. We have our culture, our tradition. We have another arm, you know, information, education, and removing the stigma and the importance of that off the education arm as well. And then we have acceptance, judgment, shame-free, key leadership, storytelling, elders, native evidence-based practices, community forum with youth, tribal council, health board, trends. So a lot of emphasis on education when you put math at the center. And then there's, you know, some spirituality, some culture, tradition. So this is when we put holistic wellness at the center. And it's a totally different picture. So first realm, we have elders, spiritual teachings. That's the foundation of what needs to happen before you do anything else. And then from that as a whole comes teaching and culture. And then the arms from here, we're building capacity, and we got to build capacity at our family level as well, not just with our providers, not just with the people that are suffering with addiction. We need to build capacity of the whole entire family and take this comprehensive approach on it to addressing this issue and addressing the mentality of that, understanding the impacts, knowledge, awareness, physical effects, provide a welcoming environment. You can see a circle created here. These came back up on the right here, came back down, then they whipped back around, and it's like, you know, so this became very, very dynamic and three-dimensional, putting holistic wellness at the center. You know, we have to have welcoming environment in our clinic, our pharmacy. We need to have, you know, this learning exchange, the nutrition, a lot of focus on, we're not using our traditional foods enough. Like traditional foods can help us heal, and you know, our herbs, our teas, and so, you know, mitigating our approaches with this traditional approaches as well. Our culture, you know, the mental, emotional, physical, the environmental, the social cultural norms, values, and you know, then it whipped back around here, you know, and so it's all interconnected, and it was just fascinating to me. And so I broke this down, and you know, just and here's, you know, kind of giving you that big picture of the two next to one another. And so summary of the findings in short, you know, is that implementation should use a strengths-based and a holistic model of OUD recovery and well-being, engagement, recovery strategies, integration of extended family traditions, addressing stigma, building trust with providers and clients, integration of healing, of traditional healing practices, ceremonies, and other cultural practices is recommended. Importance of centering Native culture in this work. And then for the dissemination and implementation, Native communities need culturally appropriate and effective substance use disorder treatments. the importance of CBPR, taking community informed or community grounded approaches to working with the community to create the process. Let culture guide the research, and consider sustainability during the intervention implementation. And then the importance of identifying frameworks and theories and models that align with the community worldview and values. Resiliency. We can heal our communities through culture connection and developing interventions and policies that are grounded in traditional Indigenous knowledge, tribal best practices, and evidence-based practice. Tribal Opioid Response National Strategic Agenda. And so the, in summary, complex factors lead to OUD, cultural strengths promote wellness, holistic health options, and support for pain. And centralizing holistic wellness compared to MOUD and the NACC resulted in different conceptualizations of treatment. Here's a quote for you. There's no way MAT's going to really work in Native communities in the long term unless we center it culturally. There's no way. There's just no way. Unless we incorporate ceremony and traditional medicine in the form of like plants or whatever is relevant to those communities, there's no way it's going to work for them. I mean, that's my firm belief. Miigwech.
Thank you very much, Melanie, for the presentation. I mean, it was really, I mean, we've done a lot of work in these, trying to map these things. I just like just really, we hit so many things, and I learned so much. I just wanted to open up. Does anybody else? Does anybody have any comments or questions or thoughts?
I don't know if you can see the chat, Mel, but Mark Newpin said stunning presentation.
Miigwech, thank you. Thank you very much.
I guess I'd like to make a comment, because, of course we have Matt here at NACC, and we recognize, we've had a lot of conversations around culture and centering culture, and the first point of entry for people a lot of times is from a place that is like, we have a medication first policy, and so it's kind of, I feel like sometimes getting patients on that is like getting them onto the life raft, right? Like it's just like, pulling them out of the water and getting them to a place where things can clear a little bit for them. Do you have any, the group that you work with have any thoughts around like just in terms of that moment of like making the connection and sort of those first sort of measures to get somebody into a place of better, higher safety? Are there any sort of strategies around that?
Yeah, as you know, it's just really, really complex. We had so many, it was just, I loved it. It was so great. We had so many conversations. There was a couple of things that stood out. I mean, a lot of great suggestions that came forth. I mean, really this, what I touched on is really starting where someone's at, because it's so important for someone to define how their healing path or their healing journey and to negotiate that process, But there was this this land healing initiative that happened in Canada, and it's actually another one of my publications. And you could look me up on University of North Dakota, and I have under the directory, and I have all my publications on there and everything. But I published with Dr. Nicole Redvers on this camp, and I was the epidemiologist on that study and evaluated and the work that they did, and helped publish that work. But this land-based healing camp, it was in a city, I believe it was Yellowknife, and they created this land-based healing camp, and you can imagine homelessness, people struggling with addiction and things like that, but just centering that healing around the land, there were some big dreams with the collaborative board of saying, geez, what if we had like a land-based healing place where people could just go, and like the foundation was like to learn how to live, which most of us have forgotten how to do. You know, like growing things. And like our men, unfortunately, we see this across the data. I don't know if you guys seen the justice report that just came out earlier this month, that was focused on American Indian, Alaska Native. And I can send it to you guys so you have that report. But the American Indian, Alaska Native people are the highest representation within race in the justice system. And our young men get sentenced longer than any other race, young Native men. And so, you know, there's so many, and I know I'm kind of going all over the place, but I'm a social behavioral epidemiologist. So I think at the societal level and how these things are all, you know, so coming back to Matt, I mean, and you guys, I'm preaching to the choir. It was really hard for me today because I'm like, I'm preaching to the choir. What do I say? But I just think that we just always have to be open to change, to innovation, to trying something new, not getting stuck in ways or keeping our hope up that this can be dealt with. A lot of people that the ones that were in recovery said that the main thing for them was that they couldn't get in when they wanted to get in. Like if the system wasn't responsive enough. And it's like, hey, I wanted to recover today. That might change by 3 or 4, you know? So being able to be very supportive and responsive in those moments. And then there was also so much emphasis on the family that we need to bring the family in, and the family has to be part of this process. And like, you know, you're dealing with HIPAA and all that stuff. And it's like, it's kind of a barrier with this stuff, because especially when you're dealing with mental health illness. And I'm not even talking just about, you know, addiction. I'm talking about mental health illness is significantly increasing in the United States. And even we see that, you know, I'm the education director for the Indigenous Health PhD program at the University of North Dakota. And I keep an eye on the trends, you know, for especially for our disparate students coming into the system. And being a first generation college student myself, you know, I pay attention to the data, and we see that our students are coming in, and this is students all across, not just disparate students. The general population of students is coming in with more than one mental issue. And your students are more and more likely to be coming into academia with mental challenges. And so we're just talking at that level. So when I think about someone who's suffering with substance use and the mental impacts that has, I just don't think that we're and I'm, you know, I gotta speak gently because I'm not a clinician. I'm a researcher, but we work hand in hand, right? But I just think that we have to be innovative in our approach to and responsive to what we're seeing in the data. And yeah, there's a lot of work to do, but I think there's a lot of hope and a lot of things that we haven't tried that we could try as well.
Thank you. I wanted to let you know there's a couple other questions for you. So Mark Newpen asked, do you invite Mexican Americans, the brown ones, are really Native Mexicans, although their tribal cultures were mostly destroyed by Spanish leaders? Any thoughts on these groups?
Oh yeah, I think about those groups all the time. When I was in, it was interesting because when I was in the cities, I did my master's in community health education with a concentration in health disparities. And people just assumed because I was Native that I was like aware of diversity. I wasn't, I was just like, no, I'm familiar with Belcourt and the natives there, and, you know, some white people down in Utah where my dad was working as a Mason. And I wasn't really worldly and understanding different Indigenous populations around the world, because they're around the world. And at one time, I'd probably argue that we were all Indigenous at one time, so, but, now that I'm getting older, I have those worldviews. And then when I was at college there, our health disparities class was actually placed within the cultural center. So we studied the Indigenous people in Mexico, Indigenous people in Asia, Indigenous people in Africa. And it was mind-blowing for me. I mean, it was a fast introduction and kind of grounding us in these different Indigenous peoples. But yeah, I find that pretty fascinating and absolutely. And there are people that are still practicing those Indigenous cultures in Mexico. And there were no borders before, right? So I'm Ojibwe. Our people span like First Nation and United States. And so, I said, hey, when I do research, I'm going to include First Nation because my people are on both sides, so I think a lot about data, and that's my area of expertise for me. And I don't think we really have a handle, even from a data perspective, on the migratory patterns of our people. We're migratory people by, historically, we're still like that today. So people are constantly going from the res to the city to, here, there, like, I don't know, we just migrate a lot. And I don't even think from a data standpoint, we really have an understanding, even from that perspective, on a solid snapshot of our people at any particular time. Oh, my concentration was in health disparities for my master's. Yeah, so my master's is community health education and health disparities, and then my doctorate is social behavioral epidemiology. I was the only one. I'm the first Native to ever graduate from the School of Public Health doctoral epidemiology degree program. And according to ASPPH, I'm the fifth one. Well, I'm the fifth one at any accredited school of public health that self-identified. Of course, I'm enrolled, but there's 4 other ones that are either enrolled or self-identified. I haven't met them yet. But I like to say, like, I'm the 5th in the universe or whatever.
Let's see, we have a couple other questions if there's a little bit of time left. So Julie Schaefer Mosca said, thank you for this information. It was very useful. I'd love to have some specific resources to offer our American Indian Alaska Native clients. We have a handful of clients up north in the Cass Lake area. Can you provide some specific cultural resources to refer our clients?
Yes, I'll dig out. I'll touch plate. I'll see where the national team's at, and then what they have existing, and I'll pull some things together, and I'll just send it out to the group to share with whoever's on the list.
Thank you. Let's see. So Tanya Aripa asked do you have any specific treatment modalities for fentanyl with our American Indian Alaska Native people?
Well, I don't know what I'm allowed to say here, but I'm a huge advocate for traditional medicines, and we have very powerful traditional medicines, very powerful. And of course, like I'd say that in use with the eating well and eating a traditional diet, you can actually detoxify your body with food if you eat the right foods, but there's a traditional tea that Linda Black Elk, she's shared out a concoction that she, promotes. And I'm, happy to share that with, but of course I, have to say that it's, just a tea, but people have claimed that they've had a lot of success with this blend that she's come up with. And you can get they're common herbs that you can probably go to Hugo's and buy in the tea section. And, but drinking that every day can really help calm you down and clean out your system. And so I think there's a lot of things that we have that when we talk about this menu of approaches to, you know, teas, that could be on the menu. We have a lot of things in our back pocket that we all have access to that we're just not recognizing and utilizing in a meaningful way in our approach to health and healing.
I think there's one other question here in the chat. Jace asked, are there recovery resources geared for Two-Spirit people in MAT?
I'll definitely look into that and see the group I know that's working out more broadly. That's something that they've kept a focus on, and recognizing that that there might be key considerations there as well. And so I'll ask them if they've, you know, have any advice at this point in where they're at in their process, and I'll share it back.
And I can make sure when I send out the survey after this that I include the resources for everybody too. So
yeah, so just FYI, you guys, I'm talking, and I don't know how this happened. This is just crazy to me. It just aligned this way. But I'm speaking for the CTN AIN SIG next. Yeah, so I'm jumping on their call next.
Marathon run.
yeah.
Yeah, so.
Well, thank you for making the time for us.
Echo ends at 1.
Yep.
Yeah, I gotta get my.
So you guys have a great day. I'll be in touch. Thank you.
Thank you.
Thank you.
Thank you, everybody. Just wanted to let you know our next session is in 2 weeks on the 15th with Mindy Bird talking about the Mending Hearts program. So thank you. Have a good day.